Hey, welcome back, everybody. It's time once again for Health Simplified, a simple guide to a healthier life with a man who, well, he makes it sound simple. I'm not always sure it's that simple to begin with, but Dr. Justin Fesler, welcome, sir.
Thank you. Thanks for having me
You
again.
really have a way of you clearly know the science and more than most, but you have a way to tell it in a way that I walk away and understand it. So I hope you don't mind if I ask dumb questions along the way.
I love it. That's great. Well, those are the questions that I think the audience probably might have. So,
I think I'm your
and I don't think they're
audience,
dumb. No question is dumb here.
Okay, well, good.
All right.
Well, today you're going to talk about something that I hear about, and I'm not really sure what it is. Peripheral neuropathy? Did
Yes.
I pronounce that correctly?
Correct. Yeah. So if you look at the nervous system, there's the central nervous system. We term that as being the brain and the spinal cord.
Right.
Everything outside of that is peripheral nerves. So it's peripheral to the central nervous system.
Okay.
That means all the nerves and nerve endings that are into your extremities, basically. With peripheral neuropathy, we're looking at damage to nerve endings, usually more the sensory nerve endings. It can be the motor too, but usually it's more sensory. So you're talking about
feeling, the touch, and everything.
correct.
Yeah.
Yeah. So you're going to feel numbness, tingling, burning, sometimes pain, those kinds of things, and it's called a stocking and glove distribution, which means if you think about how a glove would go onto your hand, it's kind of going to go up through here and the entirety of your whole hands and possibly your whole feet in terms of where a sock would cover. So the reason that matters is because it's helpful diagnostically that if that's how someone has their distribution of numbness, tingling, burning, pain, you could say that it's likely a peripheral neuropathy issue, not a neuropathy that's like a radiculopathy, which is more radiating from the spine in a certain distribution
I've had
of that
some
dermatome.
ridiculous opathies in myself there.
Yeah. And peripheral neuropathy is kind of ridiculous too, because it's really debilitating and can be difficult for people to find a solution for as well.
And persistent chronic doesn't go away, and the doctor goes, I don't know.
Yeah. So let's go into the main symptoms of that, and then we'll go into the main causes of peripheral neuropathy too. So we talked about those tingling. That's like kind of pins and needles feelings, kind of electrical. Burning, stabbing pain, numbness. You can actually have weakness, which can lead to unsteadiness, which leads to that thing we've talked before is risk of falling. So
you're hitting all the hot buttons for me.
Yeah.
Here. Okay.
And then you can also have changes in some of the sensation for temperature and vibration. So that tactile sense for people from their feet, the bottom of your feet, and then the pads of your fingers, when that starts to go, it makes it difficult to do things.
To hold things, to touch things.
Correct, yeah. Your fine motor starts to have an issue, and it makes it hard to do things with small objects or, that are requiring that kind of dexterity.
My aunt used to drop them all the time.
Yeah.
She'd pick it up and she'd go, oh my God, what did I do? Just like she couldn't hold on to something.
Yeah, so that could be something that's from a peripheral neuropathy type of issue. So that's mainly what we're looking at in terms of how it affects people and the symptoms you might see with that.
And if I went to a traditional MD, and in my 5 minutes of him explaining, what's your problem, what are you here for? Most of them would say what? They would say, go to a physical therapist, or they would say, take a pill?
They might say that, but there's some pills too that we'll get into in a little bit.
Okay.
And in terms of the causes for these, we're going to look at things like the primary one is diabetes. So B12 deficiency, that's something that a blood test, you'd go to your doctor, and so several of these things are things that you'd want to go to an MD and get a panel for. So alcohol abuse can cause that. It's a neurotoxic. So alcohol can also cause nerve damage in the peripheral
Never
nerves.
heard that before.
Autoimmune diseases, lupus, rheumatoid arthritis, those kind of things can also contribute to neuropathy. Infections like shingles, HIV, hepatitis C, Lyme disease, those kinds of things. Toxins. So some people work in areas with maybe like paint thinner or paint or things with like neurotoxic chemicals that could do it.
Somebody told me a while ago that a number of people who install granite countertops.
Interesting.
Because they're grinding that dust and they're
inhaling it.
Yes, exactly.
Yeah, that could be. Yeah, definitely. Chemotherapy. So people that are going through cancer treatment, That's also neurotoxic.
We do a show with a woman, 20-year survivor of pancreatic cancer.
Yeah.
Always suffers from neuropathy.
Does she?
in
Yeah.
her feet.
Yeah. It's rough. And some of those actually do well with some treatments as well. So we should we'll talk about that later.
Put you in touch with her,
Yeah,
because that's
exactly.
one of her common complaints. Yeah.
Mm-hmm. And then finally, even antibiotics, certain antibiotics can also be neurotoxic and can result in peripheral neuropathy. And then sometimes we just don't know. Like there's a lot of patients that have been through all the testing. They're not diabetic. They don't have any of those kinds of issues that we associate with someone that would develop peripheral neuropathy, and end up getting it anyway. And
that's
we
when
just don't know why.
Look at you like you're crazy. Like, well, there can't be any reason. And what is this, in your head or something? But you pointed out in an earlier episode, pain originates in the brain.
Yeah. And we'll distinguish pain from nerve symptoms such as numbness and tingling. When you actually lose sensation somewhere, that is less, in my opinion, of a processing issue. It's more of a peripheral issue. So the pain part, yes, but the numbness,
the sensations,
the lack of sensation is truly in that area and is not as much dependent on the brain. But treating it, from the central nervous system and peripheral nervous system can be helpful.
So what do you do to treat it?
Basically, there are, as far as the MDs are concerned, there's certain medications that they're going to go through. So we're going to go through, let's see. So let me go through a little bit of the diagnosis. So basically, really quickly, they're going to go through a medical history, right? We're going to get some information about what kind of risk factors someone has. Neurological exams, you can test your reflexes, your strength, your sensation in different ways. And then also some monofilament testing, which is a little skinny type of, it's almost like a thread that you push onto the skin, and you're able to either feel that or not. And that's also another diagnostic test. Nerve conduction studies, definitely an MD does that. I guess some physical therapists are doing it now, but not as common. Blood tests, you can do that, as far as those blood sugars and everything. And then in rare cases, a skin biopsy, because there are rare kinds of neuropathy that could be due to that. And we need to know the diagnosis to be able to properly treat it.
Clearly.
Right? So, so basically, let's see here. Let me get through. As far as...
do people just come to you and say, I've tried everything?
Yes. I mean, they think they've tried everything that they know of. Yeah.
I know people who suffer from these things, like this one we're talking about. And it's just a persistent chronic condition that they try every crazy thing or every pill or every procedure, and they somehow just shrug and go, I don't know, can't explain it, can't fix it.
Right. Yeah. No, that, and a lot of these people are on things like, so we're going to go into some of the treatment now. From an MD perspective, a physician's going to likely prescribe things like gabapentin, pregabalin, or duloxetine. And these are things that affect the sensation that your brain is sensing in the area. In other words, it's going to help with some of the pain and discomfort, but it's not going to help restore the nerve endings and restore your sensation.
Exactly.
It's just going to cover up and mask the symptoms, so you're a little more comfortable and not as uncomfortable.
And maybe you need that. I understand.
Yeah,
that,
and there are people that take that and they get good benefit from it in terms of they're not in as much discomfort, which is a good thing. But just like with any other medication, there are side effects. So there's things like fatigue, dizziness, mental fog, cognitive impairment. Some people get swelling in their feet when they're on higher doses of gabapentin, unsteadiness, and ironically increased fall risk, which is what we're trying to prevent with taking these. Yeah.
Exactly.
So some people don't tolerate it very well and they go off it, and then they're left with, not much except for possibly some physical therapy can help with the balance and stability issue, that kind of thing. So people are starting to turn more to those non-pharmacological, treatments for that too. Which brings us to, there is some evidence that electrical stimulation has helped with these kinds of patients. It takes a while, it takes many treatments because nerve endings take a long time to heal. recently there was a research study done on comparing TENS to a DC current treatment. It was a randomized control trial in the Journal of Diabetes Research. And the title of this one, in case people want to look it up and kind of look into that.
Right.
It was an open label comparative study of the impact of two types of electrical stimulation, which is direct current neuromuscular electrical stimulation and transcutaneous electrical stimulation. So that's TENS that people have probably heard of.
I've heard of TENS, yeah.
Yes. So on physical therapy treatment of diabetic peripheral neuropathy. So that was the study. That was in 2025. So just came out. So there were 150 patients over 13 clinics. They all had diabetic neuropathy. So they made sure they ruled in those people with diabetic neuropathy, not some other form of neuropathy, because there's a lot of different types. So they had numbness, pain, and weakness, basically, is what they're looking at. One group got TENS with physical therapy, and one got Neubie, which is that direct current stimulation with physical therapy.
Now, didn't you talk about that one before that? I've heard this
before.
Yeah,
so I think it was either a couple sessions ago, maybe it was last time actually. We talked about the Neubie and things it can do for orthopedic conditions.
How do you spell that? Neubie?
Neubie.
So if they want to look at it, Neubie.
Yeah, and if you go to neu.fit, new.fit.com, that's where you can find information about it if you're interested.
This is a direct current as opposed
correct,
to
as opposed to alternating current. Correct,
right.
Yes. So what they found was essentially that the Neubie group showed improvements, and the TENS group showed nothing, no change. So what we're looking at is these. So there's the TCNS score, which is one of the scores they use to assess patients with peripheral neuropathy from diabetes. They showed that if you look at statistics, we want to see that the P is less than 0.05 is statistically significant. I'm not a big statistician, but
Nor am I.
we're looking at, like, for that test, they were at 0.001, so it was very statistically significant. I better not say statistics too much because I can't really say it very well. 2-point discrimination. They found that it was statistically significant as well, which is basically looking at, can someone distinguish if they're hitting one little area versus two pinpoint areas?
Right.
And if you
That's
can distinguish that, yeah.
That's all these, when they tell me go through my blood work and everything else, just tell me where normal is, and am I above or below?
Right.
Is there a significant variation here one way or another?
Right.
And that's what they're looking for.
Exactly. And they looked at pain and vibration sense, nerve conduction velocity, all those things were statistically significant when they looked at it with the Neubie, and none of this was for the TENS.
And the difference in the Neubie is it's direct current.
Correct. Yes.
And just tell me again, we can go backwards and look at that previous episode where you talked about it in depth. Why is that a benefit? Why do they think?
Yeah, it's basically communicating with our bodies in its own language in terms of the nerve conduction. So in terms of the type of electrical signal that's traveling through the nerves, it's more closely related to a DC current than it is to an AC current.
Yeah, clearly it's not alternating, going back.
Right,
and forth.
exactly.
Right.
Yes, yeah. So that is what helps that aspect of it. And then, and so they're finding that people are having improved sensation, not just decreased pain, but also improved sensation, decreased fall risk. So they're showing good benefits for these people. And this is not a giant study like 1,000, but it was 150 people. That's pretty good.
Yeah.
So there definitely needs to be more research on this, but so far it's very promising, and we're seeing that there's a lot of even testimonial evidence that people are doing well.
And
so
how many sessions do you have to go through?
Yeah, it's not. Yeah, so it's not one of those things where you're one and done or 5 and done even. It's about 24 sessions. Yeah.
And is it actually restoring the nerve endings, or is it just stimulating them again?
Some of that's stimulating them, but there's also some restoration in terms of they are seeing some of that nerve conduction velocity that we talked about. That's actually, it's sending better signals, which means the nerve is healthier and sending a better signal. The ion channels are doing their job.
Well, that's certainly more hopeful than just covering it up with a pill. I
Yes.
know that's a first impulse, but that doesn't solve the underlying problem.
Right. So it's a nice alternative for people, and definitely a superior thing to try versus going on a medication that has, side effects to
And
it.
I have to ask, because everybody's going to want to know, is this covered currently under Medicare, Medi-Cal, or
So
any of these
this
things?
type of stimulation is not. But if someone came in for physical therapy and they were doing that, we could go through the insurance, and then the Neubie is a cash-based add-on type thing that we just do like a package of that for it. And then if someone wanted to do that without therapy, they can also do it, and we have rates for that too. But they can call our office and
And
find
you're
out
seeing
about all
some
that.
how long you've been doing it? What kind of anecdotal evidence are you
Yeah,
seeing?
we've only done a few patients with this, but according to this research, we know that there's benefit, and according to people that I've talked to, other practitioners with NeuFit and Neubie that are using the Neubie are getting great results too. So I've done a few, and we're seeing some good results, but we're not even through the whole thing. So yeah,
I don't
something
hear
we're excited about.
this is a new technology, because I've heard of TENS. I never heard of Neubie.
Right, it's relatively new. If we look back to Russia back in the 60s, the Olympians were using this, and the trainers for the Russian Olympians were using DC current. But what was happening was they were getting burns and all that kind of stuff. And you're in Russia, so they just do it anyway.
Suck it up.
Yeah, we want to win.
Right.
So they've been using that for years, but the developers of the Neubie have figured out how to make it so you don't get burnt, and they've
Control
changed the
it.
waveform a little bit to make it comfortable and effective. Yeah.
Okay.
Yeah.
Well, you're one of the few places, maybe the only place I know that's got this. Go check it out if you're having any of these symptoms or anything that might be an alternative thing. It's not it's not the only thing out there, but it's
Yeah.
certainly an effective tool that hasn't been talked about a lot here.
Yeah, and if people want to come in and do a trial, we can
There
do
you go.
that. So and we can integrate that into their sessions. We can do a couple on the house and let them see what it's like.
Wow,
Yeah.
look at that.
Yeah.
All right, just for listeners today here of Health Simplified, a couple on the house. I like that.
Yeah, yeah, for sure. Yeah, yeah. We want people to feel comfortable about whatever kind of treatment they're doing. So
And to feel comfortable, I'm putting electricity in my body. Is it going to hurt? Is
Right.
it going to burn? Is it going to all these types
Exactly.
of things that you're
Yeah.
worried about here?
yeah, so that's basically what we've got for today.
What else would you do as a physical therapist to address these symptoms beyond this device?
Correct.
Is it massage? Is it stimulation? Is it getting it working again? Or is it learning how to deal with this and counteract it somehow?
Yeah, well, there's a lot of, depends on the other kinds of symptoms people are having. If they're having issues, they have strength issues, then we're going to do some strengthening. If they have balance issues, we're going to go through some balance exercises with them. So depending on the specific needs of the patient, we're going to, custom make their rehab session according to what their goals are. Mm-hmm. So for each person, it might be a little different. Some people might have issues with mobility. Their feet might not move very well. So then we're going to do some manual therapy on those patients and try to restore mobility in their, their hips, their knees, their feet, to try to get them moving as well as possible. A lot of people have weakness in the intrinsic muscles of the feet or in the ankle muscles that help stabilize your ankle, in the hips. So if any of those things are an issue, we're going to kind of search that out, and if we find issues somewhere, we're going to address those issues with it.
My late father lived into his 90s, big tough bomber pilot, had heart attacks, had strokes, had everything, breezed through that stuff, no problem. Falling is what got him in the end.
Yep.
And
Did he have neuropathy too?
He did.
Yeah.
And my doctor kept saying, I can come up with cures for, he had, blood cancer, what is it called? I can't think of what it is. Anyway, he had cancers, he had all these things. And he said, I got cures for, not cures, but I can handle all those things. I can't handle falling. You break a hip, break a leg at your age, doesn't mend. It keeps you, suddenly you're less active, more things start to happen, and it's a downward trend, and that's what, that was his life at the end. He was falling a lot and eventually fell and hit his head, and his head brain swelled, and that was it. And a month later he died. And I thought, how ironic, the simplest of things, just moving.
I know. Yeah. It's not like you're, laying in bed with, cancer or something like that. It's just like, a normal thing you do every day, and all of a sudden it's, tragic.
Leukemia, that's what he had.
Leukemia, yeah.
So he had leukemia, he had a stroke, he had a heart attack at different time, and a bypass at different time. He breezed through all that stuff beautifully. But when he started falling, boy, that was the end.
Yeah.
And I see it in myself as I'm getting older. Shuffling my feet more than picking them up. Little things tripping me up, things that I didn't normally do, dropping things, other sorts of things, reaching. You get tired in the middle of the night, you reach for things. All of that is why your profession is so important as we age. I don't know if it's as important as it, I guess it's important at all ages depending on what's happened to you.
Yeah, well, you want to attack things, before it gets to the point
Exactly.
that it's like your dad's issue. So
Exactly.
you want to, and starting, I'm 50, so starting now, we should be doing exercise and watching our diet and kind of, you've gotten through maybe your 20s and 30s where you can treat yourself like crap and still feel pretty good.
Get up the next
Now
morning.
you gotta start take care of yourself. Look at your sleep. Look at your all those things. It means more and more. And the earlier you start, the better you're going to be by the time you're in your 70s, 80s, 90s. So yeah.
Exactly. Do you do a lot of work? Because I've seen older patients. I've been to your facility.
Yep.
Full disclosure, I've used your services for
Right.
my wife.
Yeah.
I'm impressed at the holistic approach to it. It isn't just, oh, your knee hurts, let's move it 10 times or something.
Right.
It's much more of a trying to figure out what's going on in your system here, and then
Yeah.
coming up with a
You can't
regimen.
treat any issue in isolation. So you can't be myopic in how you're addressing a hip issue or a knee
Right.
issue. You've got to look at for your lower extremity issues, you're going to look at the low back all the way down and make sure there's nothing in that chain of, like from your knee to your foot that's an issue.
Right.
And if there is, you have to address those issues so that other body part is.
But yet, I've been through
supported.
physical therapy at different times. I broke something or did something or whatever, and the doctor at some point prescribed physical therapy. And it is just kind of, to me, it felt, maybe I had bad ones, it felt like, let's just isolate this problem.
Yeah.
Let's move your knee. Let's get it functioning again here or
Yeah.
something. It wasn't, maybe there's some other causes or there's some other issues going on.
Right. Well, without getting too much into the weeds on the issues with our healthcare system,
That's a whole other topic.
yeah, and it is an issue. Reimbursements for a lot of people are going down as far as therapists. So I don't blame necessarily the clinicians in this case, because they're trying to work within the mandates of their, maybe their employer or maybe a hospital-based system, whatever.
Right.
And so they're not getting enough time with people that they
That's
can
the
maybe
key.
do the appropriate things. And
Yeah.
that's why we're different. We're an outpatient clinic. We spend, 40 minutes with every patient. We don't, have a big room where you just kind of go do a bunch of exercises for an hour.
Exactly.
You're going to spend 40 minutes with a licensed therapist with every session. And because you get that increased quality of care, the results are better. And, I think the perceived result even, which is important also, is improved also.
What do you mean by the perceived?
Well,
You
it's
feel
important
better?
that people come in and feel that they're doing something that's going to help them. The psychology of health and improving your outcomes is real. So it's not just a placebo effect. It is real in that, if you feel you're improving and healing, you are going to heal and improve.
Interesting.
Yeah, better. I mean, you're going to have better outcomes.
You're certainly going to stick with it. The couple
Yeah.
times I've been, I felt like, what am I doing?
Why do it? Yeah, I know. Yeah.
I do this, and somebody said, did it feel better? And it doesn't feel better. Sometimes it felt worse. And I'm like, I'm not even going to do this anymore.
Right,
So
yeah.
I didn't give it a fair shot, maybe.
Yeah, that's why if you have someone that sticks with you the whole time, it's kind of like if you go to a psychologist and,
Yeah.
if they only spend 10 minutes with you each session, don't really listen to you and, talk the whole time, how much are you going to get out of that one? I mean, they've got to listen to you, get your story, and make you feel heard. And that's what we do also in therapy, is listen to our patients and make sure that we're hearing exactly what their problems are so that we can come back with an appropriate treatment response. So
Well, I think you're doing something rare. You're doing God's work here, because
Thank you.
I don't think there's enough people that either, again, I don't know their motivation. Maybe it is just, I got to get you through quickly here because Medicare or Medi-Cal is only going to compensate me for 10 minutes, and they want to speed up these processes. But I don't want
Right.
to be on an assembly line. Some
No.
things, yes, maybe. You're going to operate on my knee, great, go in and do it here. But if I've got a consistent, persistent neuropathy, pain, sensation, problem, I've tried the pills, I've gone to different people, and nothing, it's a real serious condition that people don't, they kind of just shrug off, particularly as you get older. I'm sorry. They just go, okay,
yeah,
you're
yeah.
older.
Yeah, and if they don't know, why you have it or whatever, then you're not going to get the benefit of at least trying something new that might be helpful.
What
So.
percentage of your patients are older? I say of older, 65 or something.
Okay. Probably 50.
Yeah.
Yeah. A lot. Yeah. We get a lot of Medicare beneficiaries. So.
Because I just feel, I saw it with my parents. That was my last comment. I saw it with my parents as they aged. I'm feeling it myself, my wife and myself, that we don't get listened to or heard as much. We're sort of struggling. I don't know if it's because they'd rather deal with somebody younger who's going to stay with them longer, or there's something more obvious to fix. As you get older, there's lots of pains and aches and hurts, and
Yes.
after a while, it's like maybe they don't want to deal with these patients. They're too hard to figure out, and there's too many symptoms and too many problems, and
Right.
they're old, and bring me somebody younger I can help. And
Yeah, well, obviously, people that are younger are going to heal more easily. So if you get
Right.
people under 30, I mean, you don't have to do much, and they just heal. I mean,
Right.
there's a lot of issues where it's very easy to help those people as you get older. Things get more complicated, and there's more systems involved with their issue. But just a word to the wise out there: if you can get treatment earlier,
yes,
you can help your issue and stay on top of things that might seem small at the time, but let that kind of little voice inside your head say, hey, I'm gonna get this checked out just to make sure, and if you take care of it now, it'll be a simple issue, and then you won't have that degradation over time. Yeah,
now you got something big to fix down the road.
right, exactly.
Well, you got some amazing tools out there. How do they find you if they want to hear more, or try some of this stuff,
Yeah.
like this Neubie or whatever?
Right. So yeah, we're physical therapy and balance centers in Lake Forest. And if you want to call our office, we have a number. It's 949-716-1800. If you want to find us online, we're at physical.com/lake-forest. And we do have an email if people like that. It's lakeforest@physical.com.
Okay, and Fyzical again, just one last time, because you're
Yeah.
part of a nationwide franchise system
Yeah,
here, and they
I
came
know.
up with the unique name. Fyzical is?
Yeah. Confusing, but memorable.
Yes.
It's Fyzical.
FYZ, Fyzical.
Yes.
All right, well, it's physically impossible to find some of the stuff that you're doing anywhere else, I think, and it's certainly from my own experience, a breath of fresh air. Somebody actually listens to you, works with you, spends time with you, and tries to look at the whole package and not just the simple problem in front of them here.
Right.
And I think that's what we're all dealing with. As my dad's doctor said, they've got great regimens for cancer and for heart attacks and other sorts of things like that. Persistent problems, chronic pain,
Yeah. I agree with you. I know.
All right. Well, thanks for coming in again. Fyzical, Fyzical. Give them a call. Check it out. All right. Well, there you are. If you're like me, you're getting older, you're feeling it. There is some simple things you can do. We encourage you to join us as we go through these simple steps. A simple guide to a healthier life. Right here on Orange County's only community radio station, OC Talk Radio, streaming live from our studios here at the University of California, Irvine's Beale Applied Innovation Center.